Hi, this is Dr. Shavu, and I'm from PhysioChiro Wellness. And today I'm going to answer some of your questions. The typical question is what is structural scoliosis? So I wanted to draw your attention to the fact that structural scoliosis is actually different than non-structural or functional scoliosis. Structural scoliosis is actually a curvature that's fixed in the spine that is usually from genetics, birth, a congenital defect. Rather functional or non-structural scoliosis is a temporary problem, either through trauma or it's temporary pressure on the spine. Now, how do you distinguish between the curvatures? There's usually the curvature in the lower aspect or the upper aspect. So those are different types of scoliosis, or both. So you can have a C curve, which is a curve in the shape of the C. So the spine goes a little bit to one side and then goes back to its proper alignment. Those C curves could be in the lower back or the upper back. An S curve is when there's a curvature in the mid back and in the lower back. Now, those are the different types. So structural is very hard and actually you're not able to fix the structural scoliosis as opposed to a functional scoliosis. With functional, we're able to figure out what caused that misalignment and actually start to cater the spine. And depending on the age too, with scoliosis, if you catch it during the growing stages of adolescence, you're able to use bracing, use exercise, use chiropractic, and start to create better angles and start to cater the spine in a better form. Same with structural slightly. The problem with structural is that it is very fixed and harder to fix than functional. But with functional, you're able to create a better structure in the degrees and actually able to kind of bring that spine back into its proper alignment. So let's go back to structural. How can you tell if you have a structural scoliosis? So there's some early signs. Usually the shoulder blade is off, or if the hips are misaligned, or if you feel that you have more range of motion on one side than the other, that's an indication that there's scoliosis. Early x-rays as well, if we find that the spine starts to move in a certain direction through x-rays, we're able to tell that there is a little bit of a list or starting to grow into that curvature. Sometimes muscle imbalances as well. So if you feel like you're stronger on one side than the other, that's an early sign for scoliosis. And so what can treat scoliosis? That's a really big and important question. In the beginning stages, when they're in adolescence, you would want communication with the medical doctor as well as the chiropractor to help work on the alignment issue. And with that, there's braces, so structural braces that they can do to help cater the proper growth of that spine, and adolescents would have to wear that throughout their growing stages. Exercises are catered. Certain exercises work on strengthening the side that's very weak, and then stretching out the other side. So it's actually two different exercises and stretches for the side that is more convex versus concave. So if the spine is going towards, let's say, the right side, that right side is overstretched out. We have to contract that side to kind of push the spine in. So to contract that side, we're going to work on strengthening exercises. Meanwhile, the side that's underneath that C curve, so let's say the left-hand side, that side's already contracted. That's a problem. We need to actually stretch out that side. So what I'm trying to get at is the exercises are prescribed for one side different than the other, so it counterbalances and allows that spine to move straight. Other thing is that chiropractic, moving the joints allows it to push into the proper area. Some joints will have to push towards the center, some joints would have to push away. So again, chiropractic along with growing in adolescence is really important. And then so physio, chiropractic, and then the fact that massage is really important as well, is because there's a lot of inflammation in the body, and to help the body accommodate the new alignment, the new exercises, you have to break that scar tissue down and allow for that alignment to take place. So those three combinations are extremely important, and it wouldn't be chiro alone or physio alone or massage alone. It's the combination of all three, along with the communication with the medical doctor, so that we're able to take x-rays in 6 months to a year and see the progress of those degrees. Okay, anything less than 25 degrees, you're looking at mild. Anything above it is more moderate. And then towards around 36 and higher, you're looking at severe. Now, let's say you've passed the adolescent stage. So you're an adult, you've been dealing with scoliosis for a while, you might have done some exercises, but it never changed your structure. And so with that functional scoliosis, we're still able to make some effect. It just won't be, we're delaying any future problems with the degree. We're delaying any future problems when it comes to muscle imbalances, tearing. So we can help on that aspect. With a structural one, if it hadn't been worked on at adolescence, if they didn't go through that route, it's much more harder to fix. And in that case, we would help in terms of evening with orthotics, because that would be your foundation. We'd help you with exercises and ways to still strengthen the muscles, but in terms of fixing the actual structure of the spine, we're not able to do that. And I wouldn't say that anyone really could, unless it was a surgical enhancement, and the surgery is very tough, and I don't think that they would be able to do that for you, outweighing the risks and the risks and the cons from that. So I hope that answers your questions. Again, I want to draw your attention to structural is something that is congenital. It is something that comes from birth or genetics. And it is something that is very hard and fixed. Functional is more related to, it could be trauma, it could be maybe you're an athlete and you pitch with one arm, so related to mechanical. That is a little bit more easy to take care of. Both of those stages, if we are found the early signs in adolescence, you're able to help develop it from progressing to a worse case. If they're an adult, again, we can help monitor, maintain, and allow it, again, not to progress, as well as work on with the muscles, with stretching, with strengthening, and with helping to bring that alignment a little bit back in. Okay, if you have any other questions, please give us a call at any one of our PhysioChiro Wellness locations. And again, an initial assessment would be the first step, so that we have certain tests. We can see where the scoliosis is, what is the degree, what level are you at, and then see the whole clinical picture, and we can find ways that can help you in an integrated approach. Thank you so much.